that, you are not listening, you are not providing resources, instead of health, you can have sewing machines. So therefore, you need to provide resources. Next is, try to monitor through social audits. Try to monitor through people who are actually, supposed to get benefit of it all. Social audit has been actually tried out in our country, and I think it has proved very, there could be third party audit, there could be social audit, there could be, audit through the government agency also. I think everything should go on concurrently. Now, am I just talking in the air, or have we actually done it? So I'd just like to say that yes, we have done it also. There is a very interesting platform, I would say an experiment that we are doing called Gram Swaraj Abhiyan. And that's basically talking about village development. And there are numerous ministries doing their own thing during that specific time, trying to build upon each other's strength. So I do my immunization, for example. I try to operationalize my health and wellness centers. The electrification, the power ministry is trying to do electrification. The banking sector is trying to reach or the unbanked. So when so many people are in the field, then what happens that there are synergies emerge, collaboration emerges. For example, I had to do direct benefit transfer to TB patients, and they did not have accounts. So because the banking guy was right there, he could help me in opening bank accounts. So I'm just trying to say that the framework has to be very clear. You have to be clear in your mind and backed by political will and, of course, trained manpower. In fact, we ourselves had to be trained, even at senior official level, I would say, because you can't claim that I know all. Thank you.
Thank you so much. I think we're getting some very practical advice. Make sure you have a framework, keep the implementation simple and flexible, ensure that it's true collaboration, not just lip service, and making sure that we have some resources. It might be obvious. It's very helpful advice. Thank you very much. We'll move now. I think we had in this sort of speaker list, we had Katja first. I will leave Anna Ruja for the end. But Katja, we've been speaking a lot about partnerships in India now. But you are really driving one of the most successful global partnerships. So what can you share with us in terms of how to be successful?
Thank you very much. And I can say I could talk about partnership for hours, but I promise not to. Let me point out to 3 secret ingredients in partnership as we see it from Women Deliver side. And just to make it easy, we've come up with an abbreviation. So we want partnerships to leap, L-E-A-P. The first one, L, is listen. Second is elevate. That's the E. The A, accelerate cross-collaboration and integration. And then push progress forward, of course, based on data and evidence. If we talk about listening, a little bit what Priti also said, we need to listen to one another. We need to listen about what are our goals of a partnership. Our experience is that often people don't come to a partnership with the same goals. Some come for money, some come for visibility, some come for action, some come for different things, some come for all of it. But if we really listen and define the goals together, we find out how much better, how much easier it is to collaborate because we're not competing. Honest communication in a language that we all understand. I don't know about you, but when you sit with different sectors and we know all our codes here, we know all our abbreviations, but when you talk to others, they don't know them. And when we don't talk a language that people know, people feel stupid. The first thing of excluding is the feeling of feeling stupid. So when we work with other sectors, and that could be the private sector, the word sustainability means something completely different than it does right here. When we work with the land folks, the land rights folks, which we do, it's also different lingo. So that listening to the language and listening to the goals is extremely key. Then it's elevate. This is not a logo war. This is not mine is bigger than yours. This is that together we are stronger. Good partners elevate each other. We speak each other up. We don't push each other down. And that's absolutely key. That's also how we combine the strength. Because all of us have weaknesses. All of us can't do everything just as well. But good partners play to each other's strength. They don't play to each other's weaknesses. And what's also being elevated is the people that we're here for, and lift those voices up. I loved the example from the minister, also really how it came a lot from the communities. And when we work, also the play here, it was, it has to come from where the demand is. Accelerate progress. I'm being fast and cross-cut. So if we treat health only as health, we're never going to solve the issues. We need to work with education and water sanitation, environment, nutrition, all of it. And we can only do that by also inviting them in to have a say. Not come to our tent, we're really good over here, but also going out there. And that also means with the civil society, they have a key role. They are implementers on the last mile. And then the push forward on, I'm being really fast on this, I'm really, I'm really speeding it up here. Progress based on data and evidence. Reliable data and evidence, and the solution is the absolute bedrock of action, or kind of impact, let me better say that. And we need those partnerships as well, because else we'll have a data section in that issue, and a data section in that issue, and an accountability framework over here, and one over there. Transaction cost way too high, and the solutions won't work. So Equal Measures 2030 that track a lot of the good data on both gender and health, the whole accountability framework around the SDGs, let's use that, but also get it on the ground. So good partners leap, listen, elevate, accelerate, and collaborate, and push. And we need to do that if we want to be effective. Else, and I know that we're kind of getting into that, else we'll be sitting here in another 3 years and being in the same place. So
I hope we will be sitting here another 3 years, but in a different place.
Yeah, and with a different agenda,
agenda.
A much bigger impact.
Yeah.
Because
Thank you very much. So, what you should tweet now is LEAP. LEAP is the word. LEAP is the solution. I'm just curious about the lingo and this, that we need to make sure we speak the same sort of language. You've been very successful speaking Danish, actually. So should we turn into Danish now?
We could.
No.
It's really easy.
Okay, thank you. Then I'm going to finally then come to Anaruda, and thank you very much for your patience with a very complex question then. Because if you might not agree with me, but you're working on Gavi, immunization, and I would say that's the easy thing. The difficult thing we have in front of us now is the SDG agenda. And just the health goal to ensure that people can live long and healthy lives is quite a tall order. But also the whole SDG agenda and how we from a health community can benefit from that. What are your reflections on that? And how important partnerships are for that?
So thank you. And I think it's good, Anders, that you are encouraging me to not look back, but really look ahead. But I do think that our future strategies have to be informed by lessons coming out from our experience so far. What is it that has worked and what is it that has not worked? So if I really combine my India experience and my Gavi experience, then let me make a couple of reflections. One is that I do think that Gavi was a very bold and unique experiment in partnerships, at the turn of the millennium. That was the time, immunization rates had started to stagnate. 8.4 million children were dying every year in those 73 countries that Gavi started to work with. And there was so much of disparity between poor, rich countries. The world was clearly divided into two big halves at that point of time. And we know that those were deaths which could be easily prevented, because 40% of those were just because of vaccine-preventable diseases. There were new vaccines, that were available in rich countries, but they were simply not available in countries where they were needed the most because they were just too expensive. And I think so there was a very, very compelling logic that drove the birth of Gavi at that time. And one of the questions that you just asked, and Katya mentioned that if we talk about partnerships, we reflect 3 years from now and say nothing has happened. So if I look at Gavi, 18 years of Gavi, you can see it leapt. It leapt and it delivered, and why? Because it, I think, did things at scale. And this brings me to the question that somebody raised. You have to take your partnerships to a level where actually your dividends from that partnership start to exceed or greatly exceed the transaction costs. And that is what happened because we worked with 73 countries. It was not a couple of districts or a couple of countries. And these countries together accounted for 60% of the global birth cohort. So it gave us that volume, which helped us pool and aggregate that demand very, very smartly. And we started to leverage economies of scale and started to really reduce the prices of vaccines. So just one example. And I think this is a principle which is going to hold true even in SDG era, and something that we have to really build on. The second thing I think which has been discussed here is, how do you create trust and recognition? How do you have partnerships where partners speak for each other and not speak against each other? Again, I look at Gavi and I say, okay, Gavi put together a governance mechanism where it brought all those actors together, which actually could be perceived as having conflict of interest, right? So you had vaccine industry on the one hand, and you had the civil society organizations or CSO constituency on the other hand, really sitting at the same table, reflecting on issues and designing and co-creating solutions. So the point is that from how do you design a partnership that starts to move away from conflict of interest in the direction of confluence of interest. And my experience with Gavi is that once they are all a part of the decision-making process, and you can set up an environment which is very enabling and which encourages open, honest feedback, and actually that open-mindedness where you are taking in the other constituency perspective, you really start to drive very good, wise decision-making. And this is what you have seen sort of take place at Gavi, and I think this is something that really needs to be carried forward. Now, let me give you a concrete example. When I said we pool demand, did this, what innovative finance? Now, what happened was that donors actually came together and said, look, this is a goal that we believe in, right? And this is where we are going to put up predictable funding. And then they resorted to innovative financing mechanisms, where World Bank came in, and they said, okay, we are going to have this international immunization financing facility and leverage for the first time. With this is an initiative that hasn't happened, and I think it should happen more and more. They leveraged capital markets to raise $6.5 billion by doing vaccine bonds. And I think this was such an innovative mechanism that helped us front-load investments in countries and fast-forward impact. And I think that needs to happen. To me, it is really a pity that the innovative finance mechanism that drove Gavi's success hasn't been replicated. And I do think that, and the last thing, and I know that sort of the last thing I think which can really drive the success of partnerships is country ownership. What is the purpose of all these partnerships? Who do we exist for? If we exist for countries and we exist for people in those countries, then we absolutely have to respond to, first of all, listen, and then respect, and then respond to those needs. And I think from my experience, again, from India and Gavi, is that Gavi's model has worked because it truly respected country ownership, put sustainability at the heart of its model, and that is why today you have a situation where you see countries standing up and putting their own financing behind vaccines. When we started to work, then they were not paying for their traditional vaccines also. So I think a great tribute to the leadership of countries with sustainability at the heart of partnerships. Thank you.
Thank you very much. So in some way, the reflection is that Gavi is definitely not part of history. Gavi is very much part of the future, possibly not just on vaccines, but the business model, the partnership model. It's something that we can use, and that is something that I know the Gavi board is going to discuss during the spring. The future for Gavi. And there is a lot of lessons on an effective partnership delivering on something very specific, but there is plenty more we need to deliver on. I have one question to everyone before we end. Did anyone here learn anything? Did anyone here hear something new? Did anyone here reflect on what you heard? Can you raise your hand if you did that? Oh, it's quite good, but there were quite a few people that, yes, you did that as well. Okay, great, thank you. I'm not going to spend more than 1 second to say or not try to summarize, but I'd just like to go back to what the minister said initially, because I think she had some very interesting, not just the messages about the horrible situation that you were jointly addressing here, but some messages in terms of effective partnerships. First, engage people. Start with people. Everything starts with people. And also what you said, Anna Rudia, in terms of trust. You can't engage people if we don't have trust. And that might sound obvious, but it's not always a given. Sometimes we just start planning for people instead of with people. Second, also what the minister said, a very deliberate choice of who to engage. Who are the stakeholders? Who are the strategic partners? It's not that you need to have everybody around the table. You need to make deliberate choices in terms of who do you need in order to be able to deliver on what you'd like to address and to achieve. Thirdly, what you said, that by having a partnership, innovation happens, new ideas. Also what we heard in terms of flexibility, allow a framework, yes, but allow also for that flexibility and that dynamic, and that will then come if you are also true in terms of what collaboration de facto is. And fourthly, when she spoke about this board and the information, the accountability in the village, people would know how many girls, how many boys were born. Important for partnerships, communications, accountability, and using the power of data. And finally, I think for me, her most important message was about shifting minds. We can do a lot, we think, with evidence, but that won't work if we don't get the minds of people, if we don't get the feelings, the values, the engagement, the passion from people. And that, I think, is, at least for me, one of the most important things if we're going to get successful partnerships. And let's give all those passionate people an applaud and a big thank you. Before we have a final now message from someone who's really, really passionate about women's and children's health and who would have loved to be here today, who used to be the chairperson of the PMNCH Partnership Board, Dr. Michelle Bachelet. She has now taken up the role as the High Commissioner for Human Rights. And I know even in her inauguration speech in Geneva, she spoke about the importance of people, the importance of health. She's a pediatrician herself by background, and she's deeply, deeply engaged, and she would have loved to be here, but we will have a message on the video, I hope, if technology is working. Yes.
I'm delighted to be able to give this message to you all here today. I would like to start by congratulating the Partnership on Maternal, Newborn, Child and Adolescent Health for their championing of health and human rights of women, children and adolescents around the world. This Partners Forum is taking place at a critical time. We face unprecedented challenges, but also unique opportunities. This meeting is a chance for advocates for human rights, such as ourselves, to explore all issues and define where we can make a difference. It's worth noting that as we enter the 4th year of the 2030 Agenda for Sustainable Development, the vision, and I quote, to ensure that all human beings can fulfill their potential in dignity and equality, end of quote, has become even more compelling and relevant. The SDGs underscore our commitment to improving people's lives, ending the ills and injustices that beset our societies, and protecting our environment. And as emphasized in the SDGs, partnership is a goal in itself, because it is crucial to achieving all the others. True partnership requires a common understanding, shared goals, and the willingness to work together with respect, integrity, and openness. Partners must compromise, share credit, and invest time and effort in working through their differences. Partnership is a word used often and a common aim, but is far from easy to achieve, particularly in a polarized and fragmented world. PMNCH envisions a world in which every woman, child, and adolescent in every setting realizes their rights to physical and mental health and well-being. In my time working with PMNCH, I have seen how that vision unites and motivates the hundreds of partners who are part of this unique entity. The Partners Forum will highlight the work of many of these partners, showing us a pathway to greater creativity, effectiveness, and transparency. It is our responsibility and our obligation to take these lessons to heart, to reinvigorate our commitment to partnership as a global goal, yes, but above all, because partnerships across individuals, communities, agencies, sectors, and countries is a secret ingredient to the achievement of all development goals. This year marks the 70th anniversary of the Universal Declaration of Human Rights. We must recommit ourselves to the eternal vision of the Universal Declaration of Human Rights, of dignity and rights of everyone, everywhere, and stand up for human rights of women, children, and adolescents.
Thank you very much. I would just like to say one final thank you, and that is to Åsa, sitting there, and to Pascal from UN University, who is not here, who put in a lot of work organizing this session. Second is that I've been asked that the panelists for the next one of the concurrent sessions that will take place here should come to the podium. Thirdly and lastly, coffee is served. Next session will start 3:30. Thank you very much. Huh? Starts now. Oh, it says 3:30 here. It starts now.